Hi, my name is Dr. Robert Del Grosso with SF Chiropractic. I want to talk to you briefly today about carpal tunnel syndrome and carpal tunnel. You know, a lot of times we're told we have carpal tunnel syndrome. We try to identify carpal tunnel syndrome, and there's quite a few reasons for it. Carpal tunnel syndrome basically is you've got a hypothenar muscle, thenar muscles, and you've got a little tunnel that those tendons, that the muscles in the arms that work your finger flexors go through. And there's entrapment there. It can be for various reasons. It could be for a fatty buildup. It could be for a shift in one of the carpal bones in the hand. There's a lot of different reasons for carpal tunnel. But one of the things we should first identify is carpal tunnel typically is described as you get tingling and numbness in the hand. Okay, if it's a generalized tingling and numbness, that's great, that probably is carpal tunnel. But oftentimes it's misdiagnosed because what happens is it's not generalized, it's in the last two fingers or the first two fingers in the hand, different areas. And when we see that, that's not always carpal tunnel. A lot of times that can indicate that the problem's coming more from the base of the neck, from those cervical nerve roots in the neck, which travel down into the hand. So that's something we want to identify, and there are some simple tests. Thalens, Tennell's, there's an arm extension test we can use. There's some simple tests that we can use to try to identify if it's truly carpal tunnel syndrome or maybe it's coming from the neck. So my advice is anybody tells you have carpal tunnel, you suspect you have carpal tunnel, go get it checked. Go see your chiropractor. Come and see me. The number here is 813-350-9100. Give us a call, make an appointment, come on in, we'll take a look. Because truly a lot of times it's coming from a cervical lesion, from a cervical subluxation, from a problem up in the neck rather than in the wrist itself. And we can identify that, and by identifying it and correcting it, we can have the correct diagnosis and help in the right way. I'm sure you've heard many times people go for carpal tunnel syndrome, they get the surgery, they have the surgery done, the symptoms don't go away. It's because it was misdiagnosed. It wasn't really carpal tunnel, it was coming from the cervical roots, and that's something you want to avoid. We want to address it, get it right the first time. Thank you, and it was nice speaking with you. We'll see you next time.